Diabetes mellitus type 1. Diabetes mellitus type 1, also known as type 1 diabetes, is a form of diabetes mellitus in which not enough insulin is produced. The lack of insulin results in high blood sugar levels. The classical symptoms are frequent urination, increased thirst, increased hunger, and weight loss. Additional symptoms may include blurry vision, feeling tired, and poor healing. Symptoms typically develop over a short period of time. The cause of type 1 diabetes is unknown. However, it is believed to involve a combination of genetic and environmental factors. Risk factors include having a family member with the condition. The underlying mechanism involves an autoimmune destruction of the insulin-producing beta cells in the pancreas. Diabetes is diagnosed by testing the level of sugar or A1C in the blood. Type 1 diabetes may be distinguished from type 2 by autoantibody testing. There is no known way to prevent type 1 diabetes. Treatment with insulin is typically required for survival. Insulin therapy is usually given by injection just under the skin but can also be delivered by an insulin pump. A diabetic diet and exercise are an important part of management. Untreated, diabetes can cause many complications. Complications of relatively rapid onset include diabetic ketoacidosis and non-ketotic hyperosmolar coma. Long-term complications include heart disease, stroke, kidney failure, foot ulcers, and damage to the eyes. Furthermore, complications may arise from low blood sugar caused by excessive insulin treatment. Type 1 diabetes makes up an estimated 5 to 10% of all diabetes cases. The number of people affected globally is unknown, although it is estimated that about 80,000 children develop the disease each year. Within the United States, the number of people affected is estimated at 1 to 3 million. Rates of disease vary widely, with approximately 1 new case per 100,000 per year in East Asia and Latin America and around 30 new cases per 100,000 per year in Scandinavia and Kuwait. It typically begins in children and young adults. Cause of diabetes mellitus type 1. The cause of type 1 diabetes is unknown. A number of explanatory theories have been put forward, and the cause may be one or more of the following: genetic susceptibility, a diabetogenic trigger, and exposure to an antigen. Genetics. Type 1 diabetes is a disease that involves many genes. The risk of a child developing type 1 diabetes is about 5% if the father has it, about 8% if a sibling has it, and about 3% if the mother has it. If one identical twin is affected, there is about a 50% chance the other will also be affected. Some studies of heritability has estimated it at 80 to 86%. More than 50 genes are associated with type 1 diabetes. Depending on locus or combination of loci, they can be dominant, recessive, or somewhere in between. The strongest gene, IDDM1, is located in the MHC class II region on chromosome 6, at staining region 6p21. Certain variants of this gene increase the risk for decreased histocompatibility characteristic of type 1. Such variants include DRB10401, DRB10402, DRB10405, DQA0301, DQB10302, and DQB10201, which are common in North Americans of European ancestry and in Europeans. Some variants also appear to be protective. Environmental. Environmental factors can influence expression of type 1. For identical twins, when one twin has type 1 diabetes, the other twin only has it 30% 50% of the time. Thus, for 50% 70% of identical twins where one has the disease, the other will not, despite having exactly the same genome. This suggests that environmental factors, in addition to genetic factors, can influence the disease's prevalence. Other indications of environmental influence include the presence of a 10-fold difference in occurrence among Caucasians living in different areas of Europe. and that people tend to acquire the rate of disease of their particular destination country. Virus. One theory proposes that type 1 diabetes is a virus-triggered autoimmune response in which the immune system attacks virus-infected cells along with the beta cells in the pancreas. Several viruses have been implicated, including enteroviruses, especially Coxsackie virus B, cytomegalovirus, Epstein-Barr virus, mumps virus, rubella virus, and rotavirus, but to date there is no stringent evidence to support this hypothesis in humans. A 2011 systematic review and meta-analysis showed an association between enterovirus infections and type 1 diabetes, but other studies have shown that, rather than triggering an autoimmune process, enterovirus infections, as Coxsackie virus B, could protect against onset and development of type 1 diabetes. Chemicals and drugs. Some chemicals and drugs selectively destroy pancreatic cells. Pyranuron, Vaser, a rodenticide introduced in the United States in 1976, selectively destroys pancreatic beta cells, resulting in type 1 diabetes after accidental poisoning. Pyranuron was withdrawn from the U.S. market in 1979 and it is not approved by the Environmental Protection Agency for use in the U.S. Streptozotocin, Zanosir, an antineoplastic agent, is selectively toxic to the beta cells of the pancreatic islets. It is used in research for inducing type 1 diabetes on rodents and for treating metastatic cancer of the pancreatic islet cells in patients whose cancer cannot be removed by surgery. Other pancreatic problems, including trauma, pancreatitis, or tumors, either malignant or benign, can also lead to loss of insulin production. Gluten. Data suggest that gliadin, a protein present in gluten, may play a role in the development of type 1 diabetes, but the mechanism is not fully understood. Increased intestinal permeability caused by gluten and the subsequent loss of intestinal barrier function, which allows the passage of pro-inflammatory substances into the blood, may induce the autoimmune response in genetically predisposed individuals to type 1 diabetes. Early introduction of gluten-containing cereals in the diet increases the risk of developing islet cell autoantibodies, which are responsible for the destruction of the insulin-producing beta cells in the pancreas.